Today's medical-centric topic is cortisol resistance, when stress hormones stop working. Why stress symptoms persist despite normal cortisol. Many people experience chronic fatigue, brain fog, inflammation, poor stress tolerance, and metabolic issues, even when cortisol blood tests appear normal. One explanation is cortisol resistance, a state where cortisol is present but tissues no longer respond effectively to it. What cortisol normally does. Cortisol is a vital stress hormone that helps regulate blood sugar, blood pressure, inflammation, immune responses, and energy availability. In acute stress, cortisol is adaptive. It mobilizes energy and restores balance once the stressor resolves. What cortisol resistance means. Cortisol resistance occurs when cells become less sensitive to cortisol signals. Similar to insulin resistance, the hormone is present, but its biological effects are blunted. The body may respond by producing more cortisol, yet inflammation and stress symptoms persist. How chronic stress drives resistance. Prolonged stress leads to sustained cortisol exposure. Over time, cortisol receptors downregulate or become dysfunctional. This reduces cortisol's anti-inflammatory and metabolic actions, allowing chronic inflammation and immune dysregulation to continue unchecked. Inflammation worsens the cycle. Inflammatory cytokines directly interfere with cortisol receptor signaling. This creates a vicious cycle. Stress increases inflammation, inflammation blocks cortisol action, and ineffective cortisol allows inflammation to persist. Symptoms of cortisol resistance. Common features include chronic fatigue, poor stress tolerance, unrefreshing sleep, brain fog, persistent inflammation, weight gain, especially central, insulin resistance, frequent infections, and exaggerated responses to minor stressors. Why standard tests miss it. Routine cortisol tests measure hormone levels, not receptor sensitivity. A normal cortisol result does not rule out impaired signaling at the tissue level. This leads to confusion when symptoms do not match lab findings. Cortisol resistance versus adrenal fatigue. Cortisol resistance is not adrenal failure. The adrenal glands are often functioning, sometimes even overreactive. The problem lies in downstream response, not hormone production. Metabolic and immune consequences. Ineffective cortisol signaling contributes to insulin resistance, autoimmune activity, chronic pain, poor recovery from illness, and accelerated aging. It also disrupts circadian rhythm, worsening sleep and energy regulation. What improves cortisol sensitivity? Reducing chronic stress exposure is essential. Consistent sleep, regular physical activity without overtraining, anti-inflammatory nutrition, treating insulin resistance, and addressing psychosocial stress restore receptor sensitivity over time. Why stimulants and oversupplementation fail. Forcing energy with caffeine, stimulants, or adrenal boosters may worsen dysregulation by increasing stress signaling without fixing receptor resistance. Clinical takeaway. Cortisol resistance explains why chronic stress symptoms persist despite normal hormone levels. It reflects impaired stress signaling, not weak adrenals. Restoring cortisol sensitivity requires reducing inflammation, improving sleep, managing stress, and correcting metabolic dysfunction, rather than chasing cortisol numbers alone.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.